I'm Corey Doherty, and this is my presentation on traumatic brain injuries. I chose this topic because I've had 4 concussions in my life, and I use this opportunity to do a research project about it. What is a TBI? A traumatic brain injury is when there is a sudden and forceful blow to the head that causes the brain to be shaken around inside of the skull. Think along the lines of a car or motorcycle crash, sports injuries, and falling. There are different categories of TBIs based on the severity of the injury and the symptoms associated with each category. The symptoms are indicative of the severity of each. The mild traumatic brain injury, also known as concussion, comes with fatigue, headaches, visual disturbances, memory loss, poor attention and concentration, and impairments in your sleeping pattern. The moderate TBI comes with a worsening headache still, nausea, slurred speech, and no pupil dilation or constriction. The severe TBI comes with an initial loss of consciousness lasting a few minutes to hours after the blow, worsening headache still, possible seizures, and the inability to wake up from sleep. These are all graded on the Glasgow Coma Scale, scored from 3 to 15, 3 being a very severe TBI, 15 being mild. This gives the doctors a good idea of the responsiveness before they do any further treatments. On the left, you have the Glasgow Coma Scale, which you can tell by the answers to each of the responsiveness tests. The worse you do, the lower score you get, which is why 3 is the worst possible. On the right, you have the acute care TBI categorization, which is often used by nurses and other health departments to grade your TBI. So, there are no genetic risks associated with TBI. They can be passed down from generation to generation. They're almost entirely caused by accident. In 2017, patients admitted to the emergency department of hospitals for TBIs were 47% due to falls, 15% for striking their head on or against something, 14% for motor vehicle collisions, and 9% from assault. There also happens to be a high rate of incidents in the military. Of those people, 1.5 million people suffer from TBIs in America every year, 50,000 of which die. 282,000 are hospitalized for them for longer than 3 weeks. 153 people die every day from TBIs, which is roughly half the population of Maine Hall. Rates are highest for children 0 to 4 and adults 75 and up. In 2012, 330,000 children 18 or less were treated at emergency departments for sports and rec-related injuries. Most of the causes of traumatic brain injuries are entirely preventable. From sports injuries to car crashes, you can't tell people to stop playing sports or to stop driving a car just because they can be dangerous. The best course of action to prevent these injuries is to improve safety standards. For instance, the NFL has been making constant improvements to their helmets that are able to absorb more of the impact and deliver less of a blow to their head, as well as changing the rules to entice players to avoid the big hits and tackle without using their head. The chart shows the different demographics and how they are affected differently by each of the causes of TBIs. Notice how motor vehicle accidents are a leading cause across all ages, but the falls are mainly isolated to the 65 and up population. Improvements being made by car manufacturers to improve these safety features with every new model to reduce the extent of injury during impact with many new features and breakthroughs. You can see that basically every part of the car is equipped with some sort of safety feature. Airbags, which have only been mandatory since 1999, are probably the most obvious. They also come with safety. They have shatter-proof glass on the windshields to prevent the glass from getting all over the passengers of the car, and with a roll cage, so if you do happen to roll the car, it will not collapse down on you and crush you in there. You can see by this chart how once you get to 70 years of age for either gender, the TBI-related deaths skyrocket. There are currently no medicines that have passed the FDA standards for testing to help with concussions or traumatic brain injuries. The acute care is mainly responsible for decreasing the intracranial pressure, maintain blood flow to the brain, and maintain normal blood pressure and body temperature. Stimulants may be prescribed to combat fatigue symptoms in the patients, but that is very rare. Effects on exercise. Neurocognitive impairments come with disturbances of attention, memory, and executive functioning. Cognitive rehabilitation may be needed for all the communication skills and executive functioning like planning, organizing, or conscious movement. The fatigue will occur in individuals suffering from traumatic brain injuries in the range of 50 to 80% of those who suffer. Sleep disorders are common in about 30% of the population with TBIs. Exercising is very beneficial to combat long-term effects of TBI. Studies have showed that the patients who exercised were less depressed and had an improved physical capacity compared to non-exercisers. They showed fewer physical, emotional, and cognitive problems or symptoms than people who did not participate in exercise. It is most beneficial because it promotes blood flow through the heart, lungs, and brains. In a study from 2012, 40 patients with self-reported TBIs from 6 months to 5 years prior were entered in a 10-week exercise intervention program, with weekly 60-minute supervised sessions and 30 minutes of unsupervised aerobic exercises 4 times a week, using the Beck Depression Inventory to compare the outcomes before, during, and after the 10-week program. The conclusions showed that the exercise may contribute to improvement in mood and quality of life for people with TBIs and should be considered as a part of the approach to post-TBI depression treatment. In my case study, I chose a 17-year-old male who had no family history of the traumatic brain injuries, of regular resting blood pressure and heart rate, with a BMI of 23.2. He is on no medication and suffered his moderate traumatic brain injury in a car accident 8 weeks ago. He scored 10 out of 15 on the Glasgow Coma scale immediately following the accident. The exercise testing for this patient, we would do a 1-mile jog test to test his aerobic, 10 RM leg press for his muscular strength, and a 1-minute push-up test for his muscular endurance. For balance, I chose the Romberg test because it is fairly difficult and it'll give me a good idea of how capable he is on his balance. And for flexibility, we chose Apley's back scratch test and the sit and reach. It's important to know that if any signs or symptoms of the TBI return during the exercise testing, the test should be stopped immediately. But for his exercise prescription, I broke it down into 5 parts. For the warm-up, you should be doing it every day before your workout regimen, and it should last between 15 to 20 minutes. Warming up is important to get the blood flowing to the extremities and the heart, lungs, and brain. The warm-up should consist of a light jog outside or on a treadmill, or light biking on little to no resistance. The aerobic activity should be done for 30 to 60 minutes, 3 to 4 times per week at 40 to 60% of his heart rate, which is roughly 120 to 145 beats per minute for this individual. The aerobic portion of this workout should consist of moderately intense running, swimming, cycling, low-impact aerobics, and a row machine. The resistance training can be beneficial in the same ways as aerobics due to the increased blood flow to the brain, but it can also re-aggravate the traumatic brain injury symptoms. With that in mind, resistance training should be carefully monitored. We want to be doing resistance training 2 to 3 times a week for 20 to 30 minutes at about 40 to 50% of his heart rate, which is, again, 120 beats per minute to 132. The majority of the workouts we'll be doing are body weight workouts, resistance bands, and some very light free weights at first. We want to start slowly and light to reintroduce the workout training and work our way up to where he was pre-accident. Balance is very important for this individual in boosting his recovery back to a normal life. TBIs happen when a sudden jolt to the head that shakes the brain inside of the skull. This also has the ability to affect the vestibular apparatus, so regaining regular balance and stability is important to us. Because of this, we will be doing balance exercises 3 to 4 times a week for 30 to 40 minutes at around 30 to 50% of his heart rate reserve, which for him is 106 to 130 beats per minute. For balance, we'll be using foam pads, Bosu balls, and resistance bands to strengthen the stabilizing muscles in his core and his legs. We'll be working on his flexibility at the same number of days for the same time and intensity as balance. Resistance training will assist in improving his flexibility, but we'll also be doing specific exercises for flexibility like side stretches, saddle stretches, and back and shoulder stretches. The cool down is also important for him in his recovery. By allowing for a cool down period, he will lower his chance of serious injury or soreness. This should be done after every workout by doing different static stretches like shoulder rolls, neck rolls, arm rolls, as well as quad and hamstring stretches. Stretching after a workout has been proven to help decrease stress and improve blood flow and relieve stiffness and soreness in the client. So, for the special modifications for him, We want to make sure that if any of his symptoms return from the traumatic brain injury, then we are going to be done for the day until they subside and he gets cleared again for testing. We don't want to mess around with this, especially with him being so young. We want to make a full recovery, and pushing through the pain is not going to give us the results we want. Also, being so young and just returning to his routine, he's going to need a spotter. We're not doing any powerlifting, so he's going to get a spotter for all of his exercises. The last thing we want for him is to fail at an exercise and re-injure himself because he wasn't being spotted or was being spotted improperly. The balance exercises are a bit of concern at the beginning of the workout program when we're just beginning to test his balance, so we're going to want to make sure to carefully monitor him and eliminate fall risks wherever possible. These are the references I used to create this presentation to gain more information on this topic, so I could help inform all of you that are watching. This was pretty eye-opening to me because when I returned to weightlifting after my concussions, there was never any ramping up for the program. It was more of just me getting thrown to the wolves. So I'm hoping that someone can see this and can successfully and safely incorporate some or all of this into a client's life to help them make the best recovery possible. Thanks for watching. Go Birds.